This is Dr. Scott MacLean, and this is a YouTube video about implant dentistry. To give you a little history about this case, I placed 4 Speedy Groovy implants in an all-on-4 protocol and then placed a transitional bridge at the time of implant surgery. The patient waited 4 months in functional loading, and then we came back and then fabricated models and mounted them on an articulator. During this current case, we'll be taking a transitional bridge out, which has been healing for 4 months since the implant placement, and then replacing it with the final bridge, which is a profile prosthesis. This profile prosthesis will be screwed down on 4 multi-unit abutments. The multi-unit abutment comes in 3 different styles. It's straight, 17, and 30 degree, and its basic goal is to redirect the implant angle and also to bring the tissues and the abutment to the same level. So you're able to bring the abutment to what's called tissue level, so it's easier to work from a prosthetic point. You can see the beauty of these. They have a 40-degree bevel, which allows you to draw, which allows you to angle the implants and still maintain this line of draw at the end of the procedure. So we can also see you can angle the implants distally to avoid sinuses, to avoid the inferior alveolar nerve, which will enable you to get the AP spread on these cases to be as maximum as possible. Of course, if you maximize the AP spread, you're going to usually minimize the cantilever. But I still like not to cantilever these too far out the distal, especially when the antagonist is a full arch of natural teeth. We usually leave the transitional bridge on for approximately 4 months to let things heal. This is an immediate function and load, so implants placed, temporary transitional bridge placed at the same time, and the patient goes, and then we have them back for suture removal. So I usually like to take an Explorer, kind of bend it out a little bit so I can get it inside the channel, and then pull that up. Here I'm using a torque control wrench. I'm going to show you 2 different ways you can take these screws out. Torque control wrench is my favorite way to take them out. You can actually do this quite easily and get the screws out by just reversing the torque control wrench. The other way you can do it is to use a traditional unigrip driver, and you can certainly use this to do the case. So here I'm showing you that. So you can take the unigrip driver, go into the screw channel, and it's going to fit the prosthetic screw, which is holding the transitional bridge down. Once we get the screws out, then we're going to take the bridge out and place it in chlorhexidine, just so that you can kind of clean it up, just in case we go to put this back in if something's not fitting on the final bridge. So we'll take it out like this, and you can see that the tissues are relatively quite nice. We've had positive pressure down on the tissues. You can see if I pull the lip back here, and so not a lot of food or anything like that is getting underneath. During our impression technique, we've taken impression underneath this bridge area so that we actually have improved it. Here's the prosthetic screw we're going to use. They're 15 Newton centimeter torque, so when we put this in, it's important not to over torque. So take the bridge, kind of find the position of the multi-units, hold it down firmly so that it's in place. Once you get this held in place, then take the screw which is on the unigrip driver, take it to the mouth, and then put 1 screw in lightly first. So this single screw is going to kind of hold it in position, so you're holding it with one hand and putting the screw in with the other. Then we'll go to the next screw and actually follow through on the next 3 screws, kind of put them in lightly. So it's like you're putting a wall switch plate on the wall. You wouldn't want to put the first screw in completely and then come back and try to find the channels of the other screws. So it's best to put them in lightly first, all 4, and then you're going to get a little pinching. So as you push this down, since it's a profile prosthesis, it should have a little positive pressure on the gingiva. So the patients can feel this, and so it's important for you to tell them. You can take an x-ray just to confirm the seating at this point before tightening the screws completely down. Now I'm going to show you 2 ways to tighten this down. First with the torque wrench, so you can put this in, tighten it down to 15 newtons because the prosthetic screw will only accept 15 newtons as the final torque since it's a small screw. So you can see here I'm touching just 2 parts on the driver and tightening it down. So usually I take the Unigrip driver off, place it into the screw, then put the torque wrench on, and then tighten it down to 15. So pretty easy to do, and something that doesn't take too long. The other way I'll show you is to use the torque control wrench, and the torque control wrench is something you can set to 15. So make sure you do this before you start to do the procedure. So set it to 15, go back in, and it will kind of release at 15 Newton centimeters. So you're not going to over torque this. I usually take the torque control, then go back and forth, and on a rotational basis kind of tighten screws. So maybe go to the distal and then go to the anterior and just make sure that this is seated and tightened down properly. So as you can see, the all-on-4 procedure takes a terminal dentition, so you extract the teeth and we put in the transitional bridge. Now we're showing the bridge going in. This is easy for patients, and they really love it because they get a brand new start on life with their dentition. Once you're satisfied that everything's tightened down, you can do a visual check. Things are looking quite nice. You can see that we've got great position, good AP spread, not too big of a cantilever. We start to check the bite. The bite's looking pretty nice. The patient likes the feel of this. He's kind of feeling it and saying how much thinner it is because of the titanium bar that's inside of this. So it's got a Nobel Procera titanium bar. And this design is made and manufactured using a Nobel Procera 2G scanner, which enables you to see where the teeth are going to go and then how the bar is going to fit in underneath. So it works quite well. The scanner enables us to see the prosthetic space. In this case, we want to have about 15 millimeters, which we do have in this case. So it allows us to have the bar, the teeth, and all the resin for the bridge. So we're going to fill the access channels to the titanium bar with some Impergum soft light body, which is a pink color. And this is great because I don't need to put in the cotton or the cord inside these channels. I can just put the Impergum in there, which is an impression material, and this is going to seal the area off, and it makes it so I can get this off very easily. So I'm not too concerned that food or bacteria are going to get down in this area because it's a nice kind of like a rubber gasket. So I'm putting this in the 4 channels. You can see that it actually disappears quite nicely with this color. So I just recently found this material and I'm quite pleased with it. It's now important to check the occlusion to make sure your centric contacts in MI are good. So we do that, making sure that we have even contacts. So you can see here that we're going to show you in a second that there's blue contacts all the way down the back on the buccal cusp, which is the functional cusp. Then we can also take the working and non-working interferences. So we want to have group function on the 3 and the 4 to avoid popping teeth off of this. So we have group function. You can see here when we show close up, because we want to have disclusion when the patient is going into working, because we're on implants here. So we want to have disclusion of the posterior teeth. So as they work from side to side and forward, we want to have this properly controlled. So this is Dr. Scott MacLean, and this has been a YouTube presentation about implant dentistry.